you, Dr. Hamza?
Oh, nice to meet you.
So lovely to see you again.
Me too.
Nice to have you.
Hi. See you.
Welcome to Malta.
Thank you. Thank
How
you for
long
having
have you
me
been
today.
here now?
Oh, more than 10 years now.
No, but you keep coming and going.
Oh, yes.
Today he arrived.
Today you arrived, so you're just literally fresh.
Yes, very fresh.
And we got you here straight away. How good we are, me and Nora,
Thank you.
we communicate well before.
He was seeing clients, took him out for an hour, and we're back.
Ah, okay, so like literally special time just to be with us.
Just to be with you. Very
We
happy.
were saying that before we go into our actual
Yes.
subject, your speciality, because obviously the last time we met was
Yes.
last year, it's been a while, your speciality is that you take fat from a specific place
Yes.
and then, for example, inject it into the face instead of a synthetic filler. You'd
correct.
have the actual... Is this evolving? Because every time Donna comes, she keeps saying
Yeah.
that things are changing and everything's evolving. What's happening with this situation?
With the situation, this is always evolving because, you know, medical technique are evolving and the study are evolving. So what is evolving is the quality of the fat that we remove from the parts of the body and to make it long-lasting. This is the thing which is very important now. The technique that we use with the very thin cannula, preserving the fat cells, and then we transfer the fat. It's like a transplantation of this fat. So like that, we make this fat transplanted in other parts of the body, living longer. And this is...
So you process the fat?
We process the fat, yes. So we learn with time how we process the fat and what technique is the best to take the fat and what part of the fat. So this is in continual evolution, and especially so also where we use it. So we use it for the breast, we use it for the face, we use it for the hip tips. Like that we can reshape and remodel the body on the same time, yeah.
X'inhi l-attitudni tal-Maltin li għadin? Għaliex aħna naħseb bombardjati mill-medja soċjali dwar il-fillers li kulħadd irid ikabbar u jasaġera. U meta nitkellmu dwarhom kan nitkellmu dwar il-sintetiċi biex niftehmu li tixtri mill. Di l-mentalità li ovvjament huwa l-ispeċjalista tagħha illi inti qed jieħu xi ħam fejn fihom il-patata li huwa żejjed
U minn tiegħek innifsek.
minn tiegħek innifsek u qed jitfaħħulek fuq iċ-ċekk. X'inhi l-attitudni tal-Maltin?
Id-dinja tinbidel għaliex in-nies iktar qed ifittxu natural, speċjalment dis-sena rajniha ħafna. Ġifieri fil-wiċċ pereżempju qabel kienu iktar popolari l-fillers, iva għadhom popolari, però n-nies saru iktar imorru għan-naturali. Kif qed ngħidu l-fett huwa xi ħaġa naturali, ġifieri qed tuża tiegħek f'tiegħek. Ma tistax tuża ta' persuna oħra f'tiegħek għaliex ovvjament irid ikun jaqbel miegħek bażikament. Però iva qed naraw li qed speċjalment għal-ġisem qed immorru iktar għal fett transfers milli għall-implants pereżempju, għaliex iktar anke minqas side effects, taf kif iktar naturali, il-proċess, etc.
Very good. So today we're going to have a specific part of the body, which is the hips, right, and the like upper leg. Am I right?
Yes. So we are speaking. We will talk about a kind of medical disorder this time.
Okay.
And how we can approach this medical disorder. This is called lipedema. So what is lipedema? Lipedema is a kind of pathologic distribution of the fat in the body. And this causes medical problem and physical problem for the patients. So this is now is well studied for the last 10 years, 5 years especially. What is this disorder? This disorder is a kind of pathologic distribution of the fat. This fat is not the stubborn fat that we have when we gain weight or when we don't exercise. This is, unfortunately, is pathologic because it's hormonal dependent. And this happen especially in women. It happen in 1 woman in 10, which is really very important.
Okay.
This disorder, and is linked to estrogen. The estrogen controls the distribution of the fat and the capillarity of the vessels. The problem, this happened during the puberty or during the menopause or during the pregnancy, and we have this pathologic distribution of the fat. It happens especially on the legs. So, and we have a big contrast between the upper part of the body and the lower part of the body. So we have a thin body for the upper part and heavy body on the lower part. And we have many stages for this. So we have the first stage is just an accumulation of the fat. The second stage we may have a problem like pain, bruising, And the third stage, we have a kind of maybe increasing this pain, and we have like a colon for the limb, the lower limb, and this has to be differentiated between two things: lymphedema, which is another pathologic state, which is touch more the hands and the feet. This is not the case, and we have between the ankle. Between the feet and the ankle, a kind of cuff sign, which is we have like a colon limb, and with a very thin feet.
If you don't mind, Doctor, sorry, I'm going to stop you. Ma nasab aħjar donna tajd nafsi bil-Malti, għax forse mux kwaħt tukun qed jifhem eżatt.
Of course, mela bażikament din hija kondizzjoni kif qal Dr. Hamza li hija disease li taffettwa bej wieħed u 10 nisa mod speċjali, dan ma jkunx fett li jiġi sarġu l-ġisem minħabba li xi ħadd jiekol unhealthy pereżempju jew ma jagħmilx eżerċizzju. Din hija kondizzjoni li l-maġġoranza jista' jkun persuna li għandha l-upper body vera żgħir imma naraw li pereżempju l-parti ta' isfel tal-koxxa tkun kbira. Issa bażikament issir taf li għandek din il-condition ovvjament tmur għand speċjalizza, xi ħadd li jispeċjalizza ovvjament f'dan is-settur.
Ġili jista' qed ġili jkunu li jkollhom isom il-hips ma jkunu isom ħerġin.
Kunu qawwijin, tkun kbira. Maġġoranza tkun hemm ġieħ ukoll, ġifieri l-kull li jiġu saqaħ pereżempju jew jekk jaħbathom jibrużja malajr. Din qed nisimgħu iktar.
U hija xi ħaġa progressiva jew xi ħaġa?
Iva, xi ħaġa progressiva. Ovvjament Dr. Hamza jispjega iktar x'jista' jsir f'dan il-każ.
U hereditarja, ġifieri.
Mhix hereditarja. Is it hereditary?
We have, yes, some. It's still under study.
Okay,
still under study. It's more about hormonal distribution, and we have some heredity. Yeah.
And is it age related, or I mean, do you?
No.
No,
it's not age related. It's a disease that affects the distribution of the fat, and it's more related to the hormones.
Yeah.
And this is, unfortunately, it's not very known. Sometimes the patient, they don't know that they have this problem, so they see other doctors, and the doctor, they tell them only you need to lose weight, or this is lymphedema, so they do a lot of exam, they starve themselves and no results. They will lose weight on the upper part, but they still have these heavy legs. And these patients are frustrated. They don't know why it's happening. And if we don't do the diagnosis of this disease at the early stage, so it evaluates. When the evolution with time, the legs become more heavy, and they cannot walk, they have this pain, and they are frustrated because they don't know what to do.
So once it is triggered,
yes,
it doesn't go away if the hormones change.
No.
You have to treat it.
You have to treat it because there is an evolution in many stages.
Sta tikber ġifieri il-problema. Normalment kif spjega wkoll Dr. Hamza ssir maġġoranza bin-nisa li hija kondizzjoni li tiġi affettwata mill-hormones, jiġifieri tista' tkun bniedma li tagħmel dieta tistanka ma tikolx imma xorta ħadd tonqos mill-parti ta' fuq tal-ġisem imma l-parti t'isfel ħatibqa' ma tonqos. Allura ikun hemm min ikun vera frustrat ovvjament għaliex jgħidlek qed nagħmel minn kollox biex nitlef il-weight, dak il-każ hu iktar tibda tirrealizza li inti għandek din il-medical condition bażikament. Normalment affettwa anke tfajl iż-żgħar, nisa bil-menopawża, ġifieri maġġoranza nisa.
U il-fatt li għaxan qed nħarsu leha għax inti qed tajt kondizzjoni, imma l-effett tagħha huwa l-estetika biss jew hija meta ngħidu kondizzjoni tagħtik tifhem li għandek problemi mediċi wkoll.
Din id-darba hija inqas estetika u iktar medika. Din il-kondizzjoni għaliex ovvjament li jsir meta bniedem bħal Dr. Hamza jitratta din il-kondizzjoni mhux se jara l-iktar ħatraqqaq mis-sajż iva għax ovvjament in-nies estetically jekk jixtiequ, però l-iktar li ssir biex tnaqqas l-uġigħ, tnaqqas id-discomfort u tnaqqas milli din il-kondizzjoni tibqa' tikber ma' żmien. Dik il-raġuni. Ovvjament issa qed tolqot żewġ safar b'ġebla waħda bażikament.
So once we've discovered, like we spoke, so what is the next step? Like, how is the condition cured or not cured, I believe? I mean, like, there isn't a particular cure. I think it's more...
Yes, so let me explain you. So when we discover this, first we need to discover this, and then when we discover it, so we have many things to do, some clinical exam, and then we need to check if it's not a vascular problem, so we have some exam. But when we diagnose this, it's lipedema. We have conservative treatment, which is like pressotherapy, massage, and like special garment that she can wear, so to relieve, but it will not take out the problem. The only treatment for this is liposuction. And this liposuction is different from the classic liposuction because we have very weak vessels. We have all the lymphatic system, which is pathologic with this fat, the problem of this fat. So we need to do a gentle liposuction. We have these techniques, what we call them the WAL, which is water-assisted liposuction or tumescent liposuction. So like that, we spare and we take care of all the lymphatic vessels that are harmed by this fat that causes all this pain and all this bruising. So this is also the difference between the classic liposuction. We do the classic liposuction very aggressive to reshape the body. Here we do this liposuction to take care of these vessels and remove this pathologic fat.
We have a couple of photos because perhaps people can see. Ovvjament, jekk forsi mardu ndejqu l-ħadd, I mean, il-persuna li ħanorukom edha libsa underwear, ġifieri inkella ma nistgħux nuru fuq xi xed nitkellmu, ġifieri jekk hemm xi ħadd li forsi jista' jiddejja jalaq naqrajnih kemm norukom ir-ritratti għaliex irid nkun kawta fuq ċertu affarijiet, però f'da sitwazzjoni qegħdin naraw il-sistema li qed jitkellem. I mean, for me, seeing the first photo, I would not have thought that it's this condition. I would have just thought that the female is, like a bit extra, like we all do, kind of,
Yes, but these photos are for stage 1 lipedema. It's the fat is distributed because this lipedema may be associated also with a kind of, fat deposit because the patient stores this fat. So we have this in the upper part. We have seen in this case that the upper part of the body also have storage of fat that we treated with the classic liposuction. But with the lower part of the body, we need to be gentle because the fat is distributed in deep and the superficial area. So because the lipedema could be also associated with metabolic fat, which is the fat that we gain when we gain weight. It could be associated. It could be just the lipedema. The case that we have seen is more a combination of the two, because the liposuction can.
I think now we have one which is actually lipedema. No, the photo. So maybe we can see that one.
Yes, this is more lipedema. Yeah, we see the difference between the upper part of the body, which is thin, and the lower part is very heavy. And we treat it, so with this case, for example, we treated with the liposuction, we do it deeply and superficial to treat the whole limb and lower part, and we make it more balanced between the upper and the lower part,
Amazing, Dr. Hamza. I mean, for someone who's going through it, apart from the aesthetic, because we are under a lot of pressure to all look better, and sometimes if someone's conscious about it, can you imagine, you keep dieting, and obviously, at least now we can, people know that there is an option. It has its, obviously, situations to go with it, but there is an option how to get better. It's always a pleasure, huh?
Thank you.
We'll have to see when you're coming again. When is he visiting Malta, get him again. Donna, grazie qalbi, napprezza. Għanat ma tkunx inti biex ta' koordina li dal-affarijiet, napprezza minn qalbi ħafna. Għanna baqanna, issa vera ħamorru għal-ħabarijiet, pero baqanna parti fejn laqawkom ma' James Demek li huwa artist bravissimu, id-dizenja fuq il-fashion show ta' ġewwa Milan, ħwejjeġ kollha magħmulin mill-karti, ma nafx rajtu xi-ritratt inkredibbli. Pero qabel xejn għandna logħba ġdida likom, nistidinkom li titlu tarawha, għandna logħba tal-Eva Garden. L-Eva Garden qed jagħtuna wkoll rigala likom, dan huwa rigal vera sabiħ u bżonn jużuha rigal li għandek maskara u kif ukoll siru mal-eyelashes, hawnhekk qegħdin taraw ir-rigal li jista' jintrebaħ kull ma tidu tagħmlu titlu fil-paġna tal-Facebook tagħna u tħallu risposta. L-aħbarijiet qed jistennewkom u aħna nkunu qegħdin nistennewkom warahom.